This press conference is also in keeping with the protocols that we have established, that as far as is possible, we will be giving regular updates to the people of the country. The greatest weapon in the fight against the spread of this disease is accurate information. That is the greatest weapon. And therefore, the government is establishing itself as the source of accurate information. So the personal responsibility is very important. But government has to declare the overarching policy positions that would set the context within which we all operate. And what I want the public to understand is that you have a government, I'm not even saying now an administration, but you have a government that has a framework set by legislation. There are many laws in Jamaica which controls how we act. You have the Quarantine Act, you have the Disaster Risk Management Act, you have all kinds of laws for which the government must follow. And we have experience in dealing with outbreaks. We have had outbreaks of influenza before, we have had other outbreaks. And so we have residual experience, institutional knowledge to manage these things. The cabinet spent an extensive period of time discussing travel restrictions relating to the United Kingdom. The government is actively reviewing the extent of travel restrictions related to the United Kingdom. We have the Minister of Education, Minister Samoud, and correct in saying that, has held consultations with teachers and the regional staff and the central staff at the ministry. There are aspects to the plan which require, for example, we need to answer the question, how would children who have examinations coming up, PEP and CHC, how would we not disrupt their training and their tutoring? And therefore, we have some measures that we have put in place, for example, the use of public broadcasting, radio and so forth, and we just need to do some fine-tuning in the consultation. That will be done over a period of 24 hours. But it is also important that we give some hint, some notice almost, because if we were to just abruptly close school, parents some of them would be in a quandary. How do we make provisions for the home care of children? So we're signaling, and I'm hoping that our parents will start to make the necessary preparations and be able to respond should it become necessary. Any gathering that requires the issuing of a permit, we will instruct the permitting authorities, the police and the municipal councils. Did I just talk about it? And the municipal councils. At least I'm conscious of it, trying my best. And the municipal authorities not to issue any permits. Non-essential travel is not recommended. The government is leading by example. No ministerial approval for non-essential travel. In fact, it must be a dire emergency for my pen to go on the paper to say approved for travel. The cabinet secretary has also been informed, and therefore the entire civil service is also on that rule, and in fact the larger public sector is on that rule.
The CMO will speak briefly on a few cases that we now have in isolation, and that may signal, depending on the test results, that spread will have started. We hope not, but we're being as transparent as possible. When that community spread begins, the decisions around how to manage the process have to become a lot more rigid. And the Prime Minister, rightfully, having come out of the discussions that we've had earlier, essentially has given a signal to the country that in anticipation of that, some of these restrictions will have to be tightened and enhanced. So the issues around schools, public gatherings, and so on. And it is for a very simple reason. It's not because we want to restrict anybody's rights to their choices in life. It's a simple reason. The formula for defeating this virus in the shortest possible time is to reduce the risk of human-to-human transmission. The government has signaled its absolute commitment in terms of resource allocation and expenditure to ready our public health system to deal with the consequences of internal spread. And we are actively engaged now in procuring additional supplies, training our staff members, ensuring we have medicines, equipment, ventilators, beds, all of this in anticipation that if the model plays out the way we expect, we're going to have to see some hospitalization. So we want to reassure the country, it's time for us we need to appreciate the numbers for what they are. No need to panic, just a need to be concerned and to take care as we champion this particular cause together. One of the things that the country will have to discuss and understand is the numbers dissected. Even though we have said that over 1 million persons may actually be affected by the virus once you have internal spread, only a very small percentage of that number is likely to be so affected that they will require hospitalization. In fact, the vast majority of persons will have a common cold, and laryngeus, a few multi-symptoms, some rest, and they recover. Nobody wants to be sick, so we're not trivializing the risks, but we do not want the country, I certainly don't want the country to think that the introduction and the spread of the virus means that the demise of an entire population and nation. Because that's not the experience in other countries. It's certainly not going to be the experience here.
Know that we have 2 imported cases and the possibility of more imported cases, as well as the possibility of local transmission. Our strategy is really aimed at containment. How do we prevent the spread? Now, there's a lot of work that is on the ground now in terms of the public health department, in terms of tracing these persons. And what we want to encourage at this time is full cooperation on the part of the public. The public health department will be contacting several persons, and they will be offering advice because different persons will be dealt with differently. Persons we identify as very close contacts, those persons will be quarantined. Persons that we define as very casual contacts will be quarantined at home, more than likely, because we have to consider the capacity to monitor persons in facilities. And so the priority in terms of monitoring persons in facilities are going to be those persons that we expect to have the most risk.
What level of consideration was given to the Boys and Girls Championships being staged without spectators? And my second question, given that there will be a ban, no permits issued in the next 14 days for public gatherings, what does that mean for the status of racing at Caymanas Park, for example?
Bear in mind how I phrase it. So any event that requires a permit, so that is within the legal authority, remit of the government, those will not be issued. Now, I'm certain that whilst racing has some general licensing, that would not be considered because that is a regular event operated privately. That would fall in the realm of what we have asked. Yes, but not for events that are not regularly planned. The same considerations, however, would have to be brought into play by the operators. They would have to make that judgment given the context in which we are operating. We as a government, by virtue of having press conferences like these, we communicate to the public the seriousness of the event, the seriousness of the threat, and we expect that persons in their private capacity who are operating, for example, racing, would make a decision. In the same way, for example, that some private companies assessed the risk and decided that they would take certain actions in preservation of the health of their staff. We, as this crisis progresses, will give other directives. Let us say that the situation escalates, then clearly we would have to give other directives. But as it is now, we are taking action with what we have within our legal remit to do, which is not to issue permits, and those that have been issued will be rescinded and revoked, and we issue a general guidance, strong advice that if you have to keep things like funerals, weddings, church, for example, on Sunday, that we exercise our discretion and good sense in these matters. Persons who came in on flight BA 2263 on the 4th of March, we are asking you to, the Minister of Health will tell you the number, social distance. It's
Okay, so the number we have now, 8881 love.
As in number
Must
one?
remember one love.
Number one or O-N?
O-N-E, L-O-V-E, 8881 love. And we'll advertise others.
So if you call that number and just update us as to your status, and we will respond to you if it is necessary. We, by virtue of the flight manifest, we will be seeking to make contact. Now we know that not all information given could be accurate. Some people may have made a mistake in their address and we can't reach out to them or find them. So it is important that they self-identify. Now, if it is that they are, they match the case profile or they have symptoms, the Ministry of Health will respond to them, right? And so we are taking the approach that it is best that we give people the information.
Are the primary reasons why the government has not sought to impose a travel ban on the US and the UK because of economic fears and quarantine capacity concerns for returning Jamaicans?
The decision around travel restriction on different countries is based on a number of factors. First of all, the virus is present in over 120 countries, so that reason is not as significant anymore. Otherwise, 120 countries would be banned or restricted. More importantly, it is about the extent to which the virus is present in that jurisdiction, and that is juxtaposed against the size of the jurisdiction, the country. Very importantly also, it's a function of the rate of spread, because every day we get up, we monitor, and we know that over the last 24 hours in this country, 100 more persons have been reported infected, because there's a reporting mechanism which requires countries to report all the way up to the WHO, and the WHO then places that out. And if the rate of spread is very aggressive, it is an indication of the success or lack thereof to monitor, to control, or to contain, which is what we aim to do once we have the virus in the country. And by extension, therefore, the risk. There are other factors also, and you mentioned them, to the extent that there are other important variables that are linked to, that link both countries. So the United States, for example, reality is that we depend on different types of relationship with that jurisdiction. Trade relations, for example. A lot of imports, whether it's material, medicines, food, or otherwise. Those have to be placed in the consideration as part of the risk assessment, and then ultimately a decision is made. In the case of the United States, if you look at the rate of spread and where the virus is, there are some areas that are far more challenging. New York, for example, is a sort of epicenter of where the virus is spreading and spreading fast. So what we have done in public health is to examine to what extent we can offer advisories, not just about a country, but areas within a country, considering all the other factors that are important in terms of what we depend on as a country also. The UK is very worried, to be totally frank. The 2 cases that we have were imported from the UK. We are concerned about the rate of spread